this is our pre-recorded lecture for nursing care of a family with an ill child. You will find this PowerPoint in week 2 of your pediatric PowerPoints. So first we're going to talk about play therapy is therapeutic play, encouraged for children to express their feelings. So it's important to remember sometimes our children don't have the vocabulary to express how they're feeling about whether they're being admitted to the hospital, whether they are being treated for a new disorder or disease that they've been diagnosed with. And sometimes they have trouble expressing the way they feel about this. So we can use play therapy and games and therapeutic communication to bring forth a way for them to express their feelings. What if they don't know, they don't have the vocabulary to express? And our younger ones and ones that just don't understand, maybe they don't know what the word pain means. Maybe at home they call it boo-boos. Maybe they've never experienced pain, so how would they know what it's called? So the reasoning for using this is we can help them cope with what is happening in their environment, and it's a way for them to for us to have better compliance in the treatment that we're trying to provide for these children. So meaning of illness. Remember that there's differences in the responses of children than adults do to illness. Adults have more of a vocabulary a lot of times with the medical field, so when you're using terms such as disease, diabetes, they understand what you're saying. Versus if you went and you told a child, okay, you have diabetes. They're not going to know. Is that the latest and greatest toy? They're not going to know what that means. So we need to remember to put it in simple terms and to understand how they are feeling about their illness. Our children can't describe symptoms sometimes. Do they know what dizzy means? I felt really lightheaded. They might not know what that means. They might say, I felt kind of silly. So we have to try to interpret what that means to them. When we are caring for an ill child, it's important that we address the child, but we also include family in the dynamics of care. Remember, if we put our parents at ease, then our children are going to be more at ease, because they can sense that anxiety. For our infants, bring a toy from home. Maybe they use a certain blanket. Maybe they have a favorite teddy bear. Don't run out and buy a new toy. Bring something at home that's comforting, something that means something to them to help them feel more safe while they're in the hospital. As for family, remember, they might have other kids at home. Loss of income with a parent being in the hospital caring for a child. So it's important that we take all of those dynamics when we're planning the care for these patients. Toddler or preschooler, they have 3 main fears. The unknown, what's going to happen to them. Abandonment or separation, being separated from their caregivers. And fear of mutilation. You're going to cut off my arm, you're taking me to surgery to do what? To cut on what? What are you going to take from me? So if we can eliminate those 3 fears, they will tolerate this new illness, whether they're being admitted or what is going on, better. Let them know what will happen. Let them know if they do have to be away from their caregiver, when they'll get to come back. Okay? If they're going to surgery, mom and dad can walk you to the surgery door. And then once you come out, they're going to be there waiting for you. Let them know. Our school age and adolescent, let them know what will happen and what will not happen. Maybe give them a book that talks about what surgery, what procedure, what disease they're being diagnosed with. Sometimes them reading over that can help them understand the concept of what is going on. Separation anxiety. Our kiddos are at risk for the separation anxiety, so we need to try to alleviate this from happening. There are 3 stages we see with our separation anxiety. So think about when your kiddos So a kiddo is going to get an immunization. What happens? They protest, right? They're crying, they're screaming, get off me, get off me. Sometimes they got to be held down. They don't want you there. They are, get away from you, okay? And if our parents aren't there, you know, our parents or our caregivers or whoever they feel safe with is not there to be the savior at the end of that procedure, then we start seeing despair. Okay? They're alone, they're being hospitalized, procedures are being done, there's nobody there to swoop in and be that comforting person that protects them against the people that are coming in and putting in IVs. Yeah, you're providing care for them, you're doing what's best for them, but do they see it as that? Do they see it as that? They may see it as it's punishment. I got sick and now I'm being punished. So, despair. They'll start possibly developmental delays, start regressing back to a younger developmental stage, flat affect. When their parents come or their caregivers, they may not respond to them, turn away from them. And then we get to detachment. They're silent, they do not respond to caregivers. There is some major developmental delays noted. And so it's important when our kiddos are hospitalized that we are not letting this happen. Okay? We are encouraging families to come in. We are encouraging play. We are having caregivers come in and trying to keep consistent caregivers so they're not constantly getting a new nurse, maybe someone that they've seen a few times. So, care of the ill child, promoting visitation. Also remember with our teens, promote for their peers to come in and see them. Yeah, let your friends come in, see how you're doing. If they're on isolation and they can't do that, then what are ways that we can help? Skype, Facebook, Twitter, some kind of peer social interaction. Okay? FaceTime your friends. Some way for them to communicate with their peers. Encouraging our parents to participate. So if our parents can do something to care for them, let them do it, because that's what the kids are used to at home. Do we have to change every diaper while we're there? No. Do we have to feed them every bottle? No. Do we have to give them a bath? No. If the parents can do it, let them be part of that care. Supporting sibling and grandparent visitations, not just parents coming in. Sister, brother, grandpa, grandma, let them come in, visit them. Minimizing negative effects of procedures. On most pediatric units, you will see there is a treatment room. The treatment room is used for when we need to do those lab draws or put in an IV. Take them into that room to do it. So their bed, their room is a safe place. That is their safe place while they are there. Reducing or eliminating pain. Why would we give a pain medication IM if we can give it PO or IV? They already have an IV in. Why give it IM? So promoting growth and development. We kind of talked about this last week, growth and development, where they are. You know, our adolescents, that peer involvement, that school age, they're understanding the concepts, they're excelling in things. Let's tell them what is going to happen, just the facts. Let them know what's going to happen, what won't happen. Our toddlers and preschoolers' favorite toys, something from home. Same with our infants, something from home. Give our toddlers choices. Would you like a Princess Band-Aid, or would you like a Dora the Explorer Band-Aid? Give them choices when you can. Okay, that is the end of this lesson. So we will pick up next week on this lesson and go into a little more activities and go in a little more into this. This is just a pre-lecture. Go ahead and finish your assigned readings and look over this PowerPoint.